Hi, I'm Mary Metacroft. I'm one of the third-year residents here at Coastal Family Medicine. We're going to walk through our clinic real quick so everybody can see what it's like inside. This is our patient lobby where everyone waits before their appointments. We've got a really cool wall over here that was designed by the daughter of one of our nurses in a specific children area with some books and things and a fish tank so that they can have fun stuff to do while they wait. All right, this is one of our patient rooms here. All of our rooms are pretty much exactly the same for our typical exams. We have a nice table, mobile computers right here attached to the wall, chairs on the side for the patient, and then everything we would need attached. We've got a lot of local pictures as well, taken, I believe, by Dr. Torrin Davis. So this is our precepting room where we precept with our attending physicians. So this is our resident work room where we work on charts, we can call patients back about labs. We have these really cool food boxes here for pediatric patients and for our adult patients who screen positive for food insecurity. We also have fresh food at the nurses station for them as well. We have lockers in here to store anything we need. We've got a lot of textbooks as well for any questions you have. Out here, we have our huddle board, wherever we can talk about anything that's going on that day, if there are any particular issues to know about, or any good things that happened recently. Hey, we have a board talking about all the COVID-19 updates, so it keeps us up to date as we need. And then this way is the OMT clinic. So this is our room for OMT. We have a nice relaxing room with lots of great pictures of the beach, some music, if patients would like it, and a really nice OMT table. We have OMT clinic once a week on Wednesday mornings for DOs and any MDs who would like to participate too and learn more about osteopathic medicine. We also have an inpatient osteopathic service as well. That'll go to the hospital about once every other week and see any patients on our family medicine service who need any osteopathic needs. All right, we're gonna walk this way and go see our procedure clinic.
Can you fix this?
Can I fix it?
Yes.
Oh, that's what you got. Sure. Oh.
All right, so this is our procedure room. We have procedure clinic twice every week, and we do a whole host of procedures here, including skin procedures, colposcopy, toenail removals, knee, shoulder injections, IUD and Nexplanon insertion and removals, and almost anything else you can think of. That would be family medicine applied. We do colposcopy as well. We also have an ultrasound clinic each week and have been doing a lot of growth scans and BPPs lately, but we are also getting into learning more about doing AAA screenings and musculoskeletal tests with our new musculoskeletal probe. I think what else is big in here?
You're fine.
All right, Now we're gonna go upstairs and see the upstairs clinic.
Hi.
In the stairwell, we have a bunch of different letters from the wellness alphabet, which is something that Dr. Young, our psychologist, did for us as part of the difficulties of going through COVID. It's been very helpful and very nice. Alright, so up here on the second floor, we have our conference room, which is where we do our Friday afternoon didactics, as well as any other teachings like OMT teaching the morning of OMT clinic. For here we have our kitchen and lunchroom. So up here on the second floor, we also have our attending offices and our staff administrators for the program, including Ms. Joy Sessom. And now we're gonna head back downstairs. Now we're gonna head over to the hospital. All right, we'll see you over at the hospital. All right, welcome to New Hanover Regional Medical Center. We're going to go and tour through our Women and Children's Hospital first. Okay, thank you. Thank you very much. Just step at the desk there, okay? Thank you. So this is the atrium inside Women and Children's. We have a really nice grand piano here that a lot of times people will come and play during the Christmas holidays. Sometimes we'll also do events in this area as well. Last year they had Fleet Feet, one of the shoe stores in the area, come and bring a lot of different athletic shoes so you can try them on and maybe buy some. This is the Lighthouse Cafe. This is one of the places that we can eat in the hospital. We get a $1,200 budget each year towards food. Usually we don't spend it all, but typically during the year you might spend more. really nice things about the Lighthouse Cafe is that you are able to come and eat outside, which is great. Most of the year don't make sense. All right, now we're going to head up to labor and delivery. Alright, this is our triage area with our lovely triage nurses. This is where patients will come whenever they're over 20 weeks and need some sort of medical assistance, whether they stub their toe, which we've had before, they have a sinus infection, they think they're having contractions, or they're actually in labor. So now we're going to go one floor up to the pediatric unit. You just came upstairs from our labor and delivery unit. That's where you'll spend 2 months during your intra-year, 1 month in each half of the year. And now we're coming up to our pediatric unit. It's about the same schedule. You do 2 months in the first year, 1 month in each half of the year. So the pediatric playroom is closed right now because of COVID, but we can see it through the fish tank over here. This is the garden on the pediatric floor. I know I like to come up here sometimes when I just want a nice quiet moment to spend outside. But it's also really nice for the families as well to get a little bit of outside time without having to leave the floor. This is one of our typical pediatric rooms, which is really nice for families. They have roll-out beds that the families can all sleep here with their kids. And very nice for the kids. There are PlayStations in every room that access movies as well as video games, so they have a lot that they can do while they're here. Head up to the 3rd floor to see the mom, baby, and nursery. Alright, now we're on the mom baby unit and the newborn nursery floor. This is the 3rd floor of the Women and Children's Hospital. So we're just going to do a quick little walkthrough. We're going to go take a quick look in the newborn nursery, which is right behind these windows. So As family medicine, we do circumcisions for all of the babies we take care of here in the hospital. This is the room where we do circumcisions with the nurses. All right, now we're gonna head back downstairs and over to the ED. So all along this front hallway in the hospital, there are a lot of different plaques just talking about the history of the hospital and the history of medicine in general. We also have the outpatient pharmacy here at the hospital. It's a really great service for our patients whenever both they are getting discharged so they don't have to go anywhere else for medicines, but also patients who come to our clinic are able to get their medicines typically at a discounted rate here. Right down this way to the emergency room. All right, now we're going to do a quick walkthrough of the ED. Our ED has about 100 permanent beds and then about another 80 temporary beds if needed. Medical ICU is right this way. The medical ICU is an open ICU. We take care of all of our inpatients in there except if they are on a ventilator or they have anything else that needs to be managed by the intensivist. So from the ED, we're now going to head over to Oban-Pan, which is the second of our 3 options here in the hospital. Come to Oban-Pan quite a bit, especially at nights, because they're the only place in the hospital open late until about 2 in the morning. All right, from here we're going to head down to the cafeteria. All right, now we're going to walk through our cafeteria, which is open for breakfast, lunch, and dinner each day. The great thing about the cafeteria is it's really close to our call room. cafeteria also has a really nice outdoor area where we can just sit and have a break. All right, this is our family medicine workroom in the hospital. Whenever we're on our inpatient service, this is where we work on notes, talk to patients, talk to the families, and talk with anybody else we're doing consults with or need help from. So this is something we do on our BMed days, which is Thursday morning on inpatient service. We use this acronym SCREAM, in which we ask each of our residents on inpatient service to go through and pick a patient and ask all these questions to them to get to know them better socially and to get a better social history so we know what we need to do differently to help them out better. Other things that we do while we're on the inpatient service, each day someone is assigned to do teaching. So Monday mornings is traditionally EKG. Tuesday is, pharmacy teaching. Sorry, Justin. Wednesday, the attending teaches. Thursday is behavioral rounds. And then Friday morning, it'll be one of the residents doing a teaching topic of some sort. All right, we're gonna take the elevator up to the South Tower now. All right, now we're gonna go see what one of the typical adult medical inpatient rooms looks like. All the rooms are pretty similar. Everybody gets a really nice window. There's a fold-out bed for family as well as a nice chair. Everybody has their own room, which is really great whenever patients are recovering, because I know I would not want to share a room with anybody if I was feeling sick. This room has a pretty good view. You can see the Cape Fear Bridge in the background going over the Cape Fear River. So this is our resident workroom. This is where all the different residencies in the hospital can come and work together. There are also really nice free snacks and free sodas if we get thirsty, and lockers to store our stuff in whenever we're on different rotations. That's the end of our tour. Thank you guys so much for watching this tour of our clinic in the hospital. Please let us know if you have any questions.